Talk Radio.
And welcome back. It's Frankie Boyer. And so the question is, if you're collecting unemployment, should you, if you're getting benefits because you're unemployed, should you be tested for drug abuse or just having drugs in you? Should you be? It's a fascinating question. Kyle Simon, Director of Policy and Advocacy at CLAAD. Nice to have you with us. And that's exactly what a governor in Wisconsin is saying, Scott Walker.
That's correct, and thank you for having me again, Frankie. So Governor Scott Walker, in his address to the legislature around his budget proposal, basically is fulfilling a campaign promise to have people drug test whenever they're applying for public benefits. And it's something that does deserve a discussion, given that 120 people die every day in the U.S. from these overdoses. But at the same time, punitive in nature is a concern of ours.
I know that you can lead a horse to water. You can't make him drink, but you can make a horse thirsty, is what that expression is. I think it's a real ball of worms, a real bag of worms here. I think we're on a real slippery slope.
Right. Well, and we definitely should be showing compassion for people with addiction rather than incarcerating them or sending them to the criminal justice system. And what Governor Walker is doing, actually, something he should be commended for, is that he does, in his proposal, call for referrals to free treatment and social services to make sure we are getting people who have substance use disorders and addiction back into the system to where they are, getting jobs, living healthy, fulfilling lives rather than overdosing.
Yeah, I hear you. How serious a problem are we talking about? Because is prescription drug use what you're fearing most, or is it alcohol? What's the stats right now for young kids in college? What's the biggest concern? Population.
Yeah, so the college age, it's prescription drugs, of course, but not just the pain medication. There's also the benzodiazepines, the stimulants. Those are definitely an issue. But like I said, 120 people die every day from overdoses, whether it's specific for the for pills or illicit drugs.
And by the way, a lot of those people are taking drugs that were prescribed, so it's non-compliance, and it's also pharmaceuticals that are killing people. So I just want to make that really clear. It's a combination of abuse and also the regular use.
Well, it's people who are not taking their medications as prescribed, who are diverting them. These medications they serve a purpose whenever someone's in chronic pain or following a surgery or something. But if people misuse and abuse them, then they can definitely be deadly. But they can be life-saving when they're used appropriately. So this is something that not only we're losing lives because of overdoses, but it's costing the economy hundreds of billions of dollars a year in healthcare costs, crime, lost productivity. So this is something that the governor, calling for this is a good idea. Part of it, the treatment and referral to social services, but it can't be putting people through the court system and just warehousing them in prisons. We need to make sure that we are getting people better using modern drug testing technology and putting them back out into the community to be productive.
Right. The recovery for drug abuse is pretty tough, isn't it?
It is, but there are addiction treatment where you can actually go in and have therapeutic urine drug testing to make sure that people are adhering to these medications, taking them the right way, not diverting them. So it's important that the governor, something like I said, that he's actually having people get free treatment. He hasn't proposed how he wants to pay for that yet, but he should be commended for that because we need to make sure people are getting better. And the other thing that comes down to that's a concern about this, the governor's proposal, though, is, this safety net, these programs, public health care, food stamps, jobless benefits, these are people who are down on their luck and need help the most. And so there is a need for compassion here. And all this really is doing is exacerbating and perpetuating the stigma for people with substance use disorders and addiction.
We also have a lot of, in this category, a lot of people that are surprised that they're addicted, because the benzos are really addictive, and they're really destructive, and they do terrible things to people, terrible things to the mind. They make the mind think one thing and be something else.
Well, like I said, if people take them as prescribed and they're communicating with their physician, they're frequently visiting their doctor, and that's the way that they can take these medications and live a healthy life. Once people take more than, for instance, on the pain medications, if they take more than what they're supposed to, that's when it's a slippery slope at that point, like you were saying.
Yeah, I disagree with you. I don't think that we are deficient in Klonopin. I don't think we're deficient in Valium. I really don't. I think that a lot of these drugs and a lot of the scripts, and I want to just say it right now, I think that Big Pharma holds a huge key in this conversation, Kyle, and we cannot not talk about this subject without the ramifications and what's happening with lobbying with Big Pharma in our country.
Well, I will say something that the pharmaceutical manufacturers have done to help address prescription drug abuse is they're developing these medications. I'm not sure if you're familiar, if your listeners are, but abuse deterrent medications. And that's something that CLAAD, my organization, is working with the FDA to advance. And what these medications are, they're harder to crush. You probably notice pills are getting bigger. So it's harder to take more of them. It's harder to overdose on them or take too many. It's harder to crush them and snort them or inject them because they actually turn into like this viscous gel that is not appealing to actually put into your veins. So these pharmaceutical companies are developing these treatments that still will give you the same effect as far as being able to treat pain, but they're harder to actually get addicted to or overdose off of.
Well, I'm happy to hear that. That's great news.
Yeah, and they're expensive to actually bring to market, but the FDA has put out draft guidance for manufacturers to find ways that they can get labeling, that they can get these medications to market quicker so we can reduce prescription drug abuse. But they're expensive. It's a new technology, but it's something that pharmaceutical manufacturers are committed to doing.
I appreciate your coming on and talking with us about it and the work that you're doing for CLAAD. And for more information, people can go to what website?
Go to CLAAD.org, CLAAD.org, and make sure that people are, your listeners, I want to make sure they're aware of safe storage and disposal standards so that we're not getting these medications into the wrong hands and you're protecting your families. You can go to lockyourmeds.com.
Perfect. Thank you so much. And we will be back next time. Thanks for listening. This has been Frankie Boyer for Biz Talk Radio. Make it a great day, everybody, and smile.
Biz Talk Radio. The opinions you hear on Biz Talk Radio are those of the hosts, callers, and guests, and do not necessarily reflect